Today we're going to review diabetic ketoacidosis. This is a general overview to remind us what happens at the cellular level during glucose metabolism. So in this review we're going to look at some biochemistry. We're going to look at the normal glucose metabolism. We're going to quickly look at glycolysis in the Krebs cycle, and then we're going to go into DKA metabolism. So in the normal state for glucose metabolism, we see a cell membrane, an insulin receptor sitting on the cell membrane, and your glucose transporter. We have these substrates, insulin and glucose, that are extracellular, and we want to get this glucose intracellular to go into the mitochondria to produce energy in the form of ATP. So what normally happens is that insulin binds to the insulin receptor. This then allows glucose to be transported into the cell. At the same time, insulin prevents the beta oxidation of fatty acids. Once glucose enters the cell, it enters the process of glycolysis and gets broken down into pyruvate. Pyruvate then can get further broken down into acetyl-CoA to enter the Krebs cycle to produce energy. So this is what happens during normal glucose metabolism. So just like we saw in the previous slide, remember that glycolysis is going to be the process of glucose getting broken down into pyruvate to allow it then to enter the Krebs cycle. So as we see here, here's another representation, glucose, right, coming in from the extracellular matrix into the cell, going through the process of glycolysis to be broken down into pyruvate, then again gets broken down into acetyl-CoA to enter the Krebs cycle to produce ATP. Remember that the Krebs cycle is also known as the TCA cycle, or tricarboxylic acid cycle, or the citric acid cycle. In a patient that has DKA, now we're looking at a different scenario. We have a scenario basically where now we have no insulin or very low insulin, and so we're not able to bind insulin to the insulin receptor. What this means then is that glucose then is not getting transported into the cell, and it's not undergoing the process of glycolysis. So in order to produce energy in the form of ATP, we have to go through another route, and that route is through the beta oxidation of fatty acids. So fatty acids go through beta oxidation, and during beta oxidation, what happens is that long carbon chain that we see here is then broken down into 2 carbon units. One of those units is then going to be acetyl-CoA, just like we saw before, enters the Krebs cycle and produces ATP. However, it's not as efficient as glucose metabolism. In addition to that, there are an abundance of 2 carbon units kind of floating around in the cell, and those then form ketone bodies. So when you go through beta oxidation of fatty acids, you produce ATP and ketone bodies. Remember, your ketone bodies are going to be your acetone, acetoacetate, and your beta hydroxybutyrate. So the acetone, remember, is going to be that one that produces that fruity breath that you can smell in a patient with DKA. As an overview, remember, when we look at somebody that has DKA, they have no insulin, right? You're now going through a process where you have increased fatty acid metabolism via beta oxidation and increased formation of ketone bodies. Because you have increased formation of ketone bodies, now you form an anion gap metabolic acidosis. You also have a dehydration because of an osmotic diuresis. You have an abundance of extracellular glucose that is beyond the threshold of the kidney's capacity to reabsorb that. And so you have a dehydration, and as a result of that, you have a total body depletion of potassium. So thank you. That was a very quick overview of glucose metabolism and DKA.